So diagnosis of female genital tuberculosis algorithm. This is updated in the currently in 2023 as an index guideline. Index guidelines are Indian extrapulmonary tuberculosis guideline developed by the National Task Force for the Tuberculosis Management, extrapulmonary tuberculosis management, and the experts in the field. So what they say in the algorithm of female genital tuberculosis, we just have to follow this algorithm. So if the presentation, as we know, that they can present with the infertility, they have a menstrual problems, abnormal uterine bleeding, they have a chronic abdominal pain, constitutional symptoms may be there like fever, weight loss, anorexia, and if you examine this patient, there may be abdominal or tuber mass that we can get on examination or palpation. All right. So what we have to proceed further, we have to do a premenstrual endometrial sampling for a smear. We have to do a AFB culture, gene expert, histology, and ultrasound pelvis. So this is important investigation we have to do for all these patients who are having suspected female genital tuberculosis. And if all the microbiological tests are negative and our clinical suspicion is high, in that situation we can have to establish a diagnosis based on either USG, clinical examination, or laparoscopy or hysteroscopy. So if you do a USG or a clinical examination, that's just a tube ovarian mass, go to the MRI, preferred contrast as MRI or CCT pelvis. And if these findings are suggestive of female genital tuberculosis, start ATT. If it is not, ATT is not indicated here. On the other hand, if we do a laparoscopy or hysteroscopy and these findings are suggestive of tuberculosis, like if you see tubercle, caseation, beaded tubes, then that is indicate a confirmed case of tuberculosis and we can start antitubercular treatment. And if findings are not suggestive of definite TB, then ATD can be based on the expert assessment and as per the patient profile. And if laparoscopy is normal, here ATD is not indicated. On the other hand, if after doing premenstrual endometrial sampling as a first test, if any of the microbiological test is positive, anything is positive in that endometrial sampling, if gene expert is positive or AFB is positive, so that or histopathology is showing granuloma, classical granuloma of tuberculosis. So in that situation, it will be labeled as a confirmed case of tuberculosis and we will start antitubercular treatment in that case. So this is just a updated algorithm for approach for female genital tuberculosis. Hope it will help. Here important point to consider is this: we have to, at the first point, if we suspect, then we have to do a premenstrual endometrial sampling and we have to do this investigation before going further. So all the patient having a suspected female genital tuberculosis must undergo premenstrual endometrial sampling for a smear culture, gene expert, histopathology, USG pelvis. Alright, so this is all for today. In the coming time, we will upload a detailed video about the discussion. So stay tuned and